Hello everybody. Today's video is on a topic that was requested, so you can request individual topics. The topic for today is headaches and migraines. So that was a great request, and thanks for the person asking for it. And I'd like to teach you briefly tonight about headaches and the most common childhood headache, which is migraines. As always in the video tonight, remember that this is general medical advice and may not apply to your individual child. If you have concerns about your own child, always seek advice from your actual pediatrician. This is just general, but there are some things you could learn that may help you and your family, I hope. One of them is that migraines, since they're the most common childhood headache, have been studied a lot, and we know that the two most common triggers are dehydration or a lack of fluids and sleep deprivation, a lack of sleep. And it sounds like that'd be hard to happen, but it turns out in many different scenarios that it's actually very easy to become dehydrated by just forgetting to drink enough water during the day or drinking too many caffeinated drinks that aren't as hydrating. And sleep deprivation is extremely easy to happen. So many children have a disturbed sleep-wake cycle, or following a sleepover at a friend's house, or a really busy trip or vacation. They may just not get enough sleep each night and may fail to maintain their routine, and that can be a trigger for their headaches. So when we see your child in the office, we would like to check up blood pressure. It's rare that elevated blood pressure would be a cause for headaches in children, but it's possible, so I like to rule that out. And we like to check a vision. So certainly, if you thought there were any problems with your child's vision, you could go ahead and let them be seen by an eye doctor just to make sure everything was fine there. We have found that some children have fewer complaints of headaches if they have underlying allergy symptoms and the parents begin a daily antihistamine, such as Zyrtec, Allegra, or Claritin. You can use the non-stating antihistamines in the morning, and that can control some allergy symptoms throughout the day, which may result in improved headaches. Another thing that can happen we see is if children skip meals, they may have some lower blood sugars that could trigger headache as well. So we encourage you to make sure they have protein at each of their meals and that they're not skipping meals. Sometimes this can help also. We would also recommend that you begin to keep a headache journal. That means you write down when the child does have a headache, describe the headache. What's the location? Describe the intensity. Describe what you maybe tried to give them to see if it got better, and think of anything different or unusual that day. What we're looking for are specific triggers that could have brought this headache about, and hopefully if you could figure out a trigger, then we could try to eliminate it, which would be awesome. The other thing we like for you to keep a journal, the other reason is if you can keep track of the intensity and the frequency of the headaches, and then you realize through journal keeping that these are increasing, worsening intensity, worsening frequency, then that's a reason to come to see us, and then eventually may even be a reason for us, your primary care pediatrician, to refer you on to a neurologist who would specialize in the treatment of more severe childhood headaches. So some characteristics of a migraine headache in a child would be nausea, even vomiting. Some children have relief of the headache pain after they throw up. Sensitivity to light or to sound, and sometimes avoiding these triggers, avoiding very bright lights like wearing sunglasses outside can sometimes help the child not to develop a migraine headache. Now, some children have something called an aura. It's spelled A-U-R-A, before they develop a migraine headache. An aura is a feeling that the headache's going to start later. So if you have any clues that your child is about to get a headache, like that aura, or if they just begin complaining of their head hurting, first of all, think maybe they're dehydrated. Encourage them to drink a lot of water, and you can give a dose of Tylenol and ibuprofen simultaneously to try to nip that headache in the bud. And a lot of times if you'll give them a dose of both initially, you'll be able to stop it so that you don't eventually need more and more medicine if the headache just persists. Also for migraine headaches in specific, if the child can go to their room and you make it as quiet and dark as possible and they can take a nap, almost always sleep is the perfect cure for migraines, and even sort of helps us diagnose it as a migraine if the sleep completely made it go away, which is awesome. You can also try just supportive care, things like a cold wet washcloth on their forehead or a warm wet washcloth on their neck to help those neck muscles relax. You can massage those neck muscles, and that can help as well. Now, I want to give you a few red flags or things that should cause more concern. If your child is having visual changes with a headache, if your child is confused with a headache, if the intensity or frequency is worsening, if the headaches are associated with vomiting first thing in the morning, If your child is losing any sort of strength or sensation or has unusual neurological signs, all of these things would be extremely concerning, and you should be seen as soon as possible. So like I said, this was a very brief overview of headaches, and I hope that you found that helpful, and please submit any additional requests for topics. Thanks.